Hey everybody, welcome. We're doing a new segment now on Facebook Live. We've been doing webinars, as you know, and today we're starting a new segment. We're going to do the three most common questions over the last month that we've received, and we've had several webinars that we've put out recently, and have gotten lots of feedback, and we appreciate everybody tuning in for those. So thank you. We'll try to keep those coming, and in an effort to keep everything as focused as possible on where we are. Today's three questions are all sort of centered around the idea of managing the COVID-19 reboot, if you want to call it. So for those of you, the first question that we're going to address centered around the recent webinar we did with Chad Madden. And for those of you looking for that, you can go to our lightforcemedical.com website and check out our webinar history, where all three of these questions are centered around. But this one was titled Rallying Patients During the COVID-19. And Chad did a really nice job talking about how he's managed it with his clinics, as well as he's actually even opening two new ones as of 2 months ago. So unbelievable that he's been able to do that, but gives lots of tips and secrets. And one of the things that came out in that talk, there was a few things I wanted to share with you today. One being that the patients that came back to his clinic first were the laser users. So his patient population that was paying for laser, they were the first ones to put their hand up and say, hey, I'm ready to come back into the clinic, because they knew how unique that service was. It was something they couldn't get at home. And in they came, and the best part is they had cash in hand and were looking for ways to basically get their program going again. So for those of you that do have a laser, those should be, the take home is they should be the first list of patients that you contact to bring back in. The other thing that he shared was just that the key right now is trying to re-engage with patients, as we know. So, in addition to just making very clear on your website and when you contact patients what safety measures you're taking to ensure that the patient can be comfortable when they come back to your facility, you want to try to re-engage with them. And the laser has just been a great tool to outreach to those patients and let them know, hey, I have something that can help get you out of pain. The thing to remember is pain's a huge motivator for patients, and most of them have regressed in the last 2 to 3 months. So they've been sitting on the couch. So those stiff joints, sore backs, sore necks have gotten worse, and they're going to be looking for a solution. Nothing better than being able to offer something that's drug-free, easy, passive, and can usually turn the needle within 1 to 2 treatments. So you can use that as a marketing message to try to get people to come back in. With the virtual world that we're living in right now, telehealth has seen a little bit of a surge, but as we know, we're really trying to do our best to get people back in the clinic. So offering them a service that they can't do at home is key. Again, we talked for over an hour on this topic, so if you want a deeper dive, please check out that webinar that we did with Chad. It's outstanding. Second question centers around somebody who wrote in and said, hey, I have a 10-watt light force laser, usually does pretty good, but I have a tough time getting results with my low backs. How does the higher power of the new units help? So this is obviously a big question, deep dive, one that we get regularly. This was covered in our webinar, What is Laser Therapy? And actually I've covered it on a handful of different ones, but that's the most recent one. So if you're new to the game and you're looking for a little bit more flavor to that answer, please check out that webinar. But the big picture is that the higher power will allow you to apply dose to deeper tissues faster. So that's part one. Part two is you can treat bigger areas in less time, which when you're dealing with low backs makes it easy. And specifically to this question with the 10-watt laser, just to give you an example, when you think about the area for a low back from L2 to say S1, you're going to be looking at roughly 400 centimeters squared. So if that was the case, you'd have to apply 6,000 joules to that area to dose it at what we're recommending now, which is around 15 joules per centimeter squared. With a 10-watt laser, that would take 10 minutes to do that. So with the lower power laser, if say you were looking at your watch and going, I don't have 10 minutes to spend with this patient, I'm only going to do 6 or 8 minutes of treatment, your dose for that deeper tissue might not be adequate to make that outcome be ideal with the laser. The other common error that folks make is that when they're treating, they don't stay married to the area that they initially measured. So in this case, we're talking about a box between L2 and L5 on both sides being about 400 centimeters squared. If you started drifting laterally or down into the glutes, all of a sudden now that area has increased. That's going to significantly reduce the dose calculation that you've made, which would likely underdose something that's a deeper structure, and the result would be that you might not get a great result. So for folks that are using lower power, just understand you can't cheat on the time, because you need that to get the right amount of energy into the tissue to get the problem to turn around. Again, any questions on that, please go to the webinar series. We've got a handful on treating low back specifically, as well as dosing in general. So they'll take a much bigger snapshot of that question and help fill in those questions for you, because that can be challenging. Last question we had was on our recent webinar we did with our CEO, Brian Pryor. Got lots of feedback from that, and it was the review of current literature. One of the topics that we discussed was the aspect of preconditioning, and he was talking about a study out of University of Florida that was put out last year, and it talked about with eccentric bouts of exercise, if you use the laser in between, that it helped improve power output and fatigue characteristics. So the question is, how could you use this in the average clinic? And the thing to understand is this concept of preconditioning. If you want to get a nice overview of it, there's a great paper written in 2014 from Agrawal, A-G-R-A-W-A-L, and they talk about how preconditioning can affect a whole bunch of different types of cells. But for what we're going to talk about today is just, and what that paper talked about by Paul Borsa out of Florida, was on muscle tissue. So what it does is basically help it deal with oxidative stress, and basically allows the cell to produce, the mitochondria to produce more ATP, which helps keep the cell healthy, utilize oxygen more efficiently, which can help prevent apoptosis and mechanical damage during eccentric. So with the better force production, just by a quick review, with delayed onset muscle soreness, there's a physical component and it's followed by a chemical component. So if you can use the laser before treatments, before you're going to have patients get into their resistive regimen, it can help minimize how much soreness they're going to have after, because it's going to help reduce the amount of physical destruction on that muscle tissue. So using it as a treatment to do as early as possible in the session, so that they're going to have, it takes about 30 minutes to 2 hours to get max benefit from that treatment, is what the research is showing. But using that before can help minimize soreness on the next day or 2 days following your treatment. So as we know, these patients are going to be coming back to see you. They probably haven't been exercising much. They are going to get sore. So you could use this as a tool to minimize that. And I would strongly recommend using that as a message when you're contacting patients or outreaching in your social media or however you're marketing to get people back in the door, that, hey, we have technology to minimize your soreness when you get back into your program. So I think that really is going to resonate. Just remember that pain is a motivator. It's the reason why patients generally came to see you in the first place. So if you can push that button to help them understand how the laser and how your clinic's going to help them get out of that, you're probably going to have a winner there. So hopefully that helps. Again, we're going to be doing this every month as a general review of the 3 top questions we get. So keep them coming to our website. Again, that's at www.lightforcemedical.com. You can always post a question, and if we don't answer it directly, we probably will within a day or two. Maybe we'll use it in the next discussion here. So thanks, everybody. Have a great weekend. Take care.